Welcome back, everyone. I wanted to make this video because I feel like, given that I study epidemiology here at Cambridge, or otherwise known as the study of diseases, it makes sense for me to use what I've learned and explain what the current outlook on controlling coronavirus looks like. So, for a pretty good basic introduction into what coronavirus is, I encourage you to check out Ali Abdal's video. He does a really good job at breaking down what the virus is, why people are panicked, and how you can protect yourself from it. So in my video, I'll aim to take the scientific literature and communicate that into more accessible information for you, the YouTube community. So let's get into it. The first thing that I want to go over is the question of why it's been so difficult to control coronavirus, or COVID-19 as I'll start calling it. So as a global community, it's not that we were unprepared necessarily. We learned a lot of lessons from the SARS outbreak back in 2003. So we have many global initiatives about epidemic control under organizations like the WHO, and actually the time it took between identifying the first case and sequencing the virus was a lot faster for COVID-19 than it was for SARS. And in general, researchers are better prepared now than they were before, with data collection tools that they could distribute to researchers and the general public. So, for example, Johns Hopkins made this really cool, fantastic interactive visualization, which I'll pull up here. You can see the total number of confirmed cases and the total number of deaths, as well as the total number of people who recovered, and it provides a nice map where you can look at the distribution of cases by country. The other thing too is that clinical trials began almost immediately as soon as the number of cases began to rise and people started to take note about what this virus was. The other thing I want to say is that China especially has a much better educated workforce, more expertise, and an improved medical infrastructure compared to 2003. So given all of this, what are some reasons why COVID-19 is still so prevalent and spreading so quickly? Some possible explanations that researchers have hypothesized are that, one, the epicenter is in Wuhan. So given that it's a population-dense city, known for being a transportation hub with a huge international airport, a huge train station, as well as several ports, all of these factors have absolutely accelerated person-to-person transmission. Another key point is that the presentation of COVID-19 is much more mild compared to something like SARS, where SARS resulted in immediate acute respiratory symptoms. So detection of COVID-19 during the early phase of infection has proven quite difficult. And that's actually when most of the transmission occurs. So this pattern is actually a lot more similar to the common flu, which happens every year, oftentimes twice a year, and it does so silently. COVID-19 may also be biologically more evolved to transmit itself. And there's a way that epidemiologists sort of quantify this idea. We call it a reproduction number, and basically it's a metric that we use as epidemiologists to represent the expected number of cases directly generated by one infection in an at-risk population. So for COVID-19, it's estimated to be somewhere around 2.5 to 3. So that means for every one infection, we can expect 2.5 to 3 new cases. And this number is a lot higher than the reproduction number for SARS back in 2003. So now that we know some of the hypotheses behind why COVID-19 has been so hard to control, let's assess how effective current measures are at dealing with this outbreak. So of course China, for example, has the political capacity to initiate lockdowns on a scale that can't really be achieved in more democratic countries. But other countries like Italy, South Korea, and Iran have encouraged primarily isolation with techniques like quarantine zones, promoting self-isolation when people suspect symptoms, shutting down public places, shutting down public institutions like schools, and limiting travel. The other thing that they started doing was contact tracing, which means trying to identify and track all the people that confirmed cases may have been in contact with. The question remains, are these measures effective? A research group at the London School of Hygiene and Tropical Medicine recently published a paper where they mathematically modeled and simulated the feasibility of isolation and contact tracing at controlling outbreaks. So I won't go into the model details too much because it's a lot of math, but I will list the assumptions that they used because I think that understanding these are really important in contextualizing their conclusions. So in their best case scenario, they assumed a reproduction number, so again, the expected number of new cases per one infection for an at-risk population. They assumed that this number was 2.5, and they also assumed a short delay between onset of symptoms and isolation, meaning that people would immediately seek treatment or go into quarantine when they realized that they started exhibiting certain symptoms, flu-like symptoms. This paper also assumed that 15% of transmission would occur before onset of symptoms, and that there would be a subclinical infection rate of 0%, which means that everyone who is sick will seek care, which may not be the case. They also defined control as no new infections between 12 and 16 weeks. So the main results were that to achieve control of 90% of outbreaks in 3 months, 80% of people would need to be traced, meaning have their contacts mapped out, and isolated in the best case scenario. However, if we assumed a long delay between onset of symptoms and isolation, which is the more likely scenario, the probability of achieving control in their simulations fell from 89% to 31%, which is more plausible since symptoms are so mild that people may not even be aware that they have the infection and they won't therefore seek care. The researchers found that in some plausible scenarios, case isolation alone would be unlikely to control transmission within 3 months, especially if we assume that people are not reporting their symptoms. So overall, their study indicates that in the most plausible outbreak scenarios, unfortunately, case isolation and contact tracing alone are not sufficient to control outbreaks, but rapid contact tracing can make the control easier overall and the burden less for healthcare systems around the world. So this may sound negative, and it kind of is. It definitely wasn't the positive, cheerful conclusions I was looking for when I was searching for these papers. But I think we as a global community have to change our mindset from this idea of rapid, complete elimination to, which is not sustainable given that most countries have a shortage of resources and they may not have the infrastructure to deal with the, higher than expected number of cases, to a more controlled control. And what I mean by this is that doing as much as we can to limit the number of new infections so that our respective health systems and our respective countries can support these patients. Then, hopefully, if history is any indication, and I believe it is, the life cycle of a virus will always die out once herd immunity kicks in. And there's something to be said about this because the fatality rate is actually fairly low, and lots of people are recovering. So populations are gradually becoming immunized to the virus. And what's promising as well is the case of South Korea. So the rate of new infections has recently been steadily decreasing in South Korea, and researchers have attributed this to South Korea's systematic and democratic response, including things like mass testing, where they established the system of free drive-through diagnostic testing, improved public communication about hygiene practices via twice-a-day media alerts and emergency alerts to your cell phone, and syndrome surveillance using cameras to watch suspected infection areas, tracking movement of confirmed cases via phones, and using mobile apps where users could track development of their infection and make that information public. Also, I think what was really important in the case of South Korea specifically was sort of this general population ethos to feel the need to self-quarantine themselves the moment they feel symptoms in order to, benefit the larger community. And all of these things, all of these preventative steps reflect the rapid case isolation and contact tracing that the previous study I discussed would make sort of control of this outbreak a lot easier. So in terms of treatment, although trials are currently underway to identify potential COVID-19 specific vaccines, another recent study recently identified the importance of adequate nutrition via things like vitamins, omega-3 fatty acids, iron, things like that, supplements like these that would bolster your immune system, since most of the confirmed cases have actually been of the elderly or the malnourished or of the immunocompromised. Also, another interesting thing that this study found was that children who received the basic RNA virus vaccines, so like the measles vaccine, rubella, polio, these types of vaccines that most children get around the world, didn't seem to get infected. So it may be that in the interim of waiting for this new vaccine, a combination of these general vaccines that already exist may be beneficial to immunize people and prevent further transmission. So I hope that this video was useful to you. I did my best to research primary literature from reputable journals and try to translate their findings and do my best to communicate good science in an accessible way. So all this information that I presented is accurate as of March 10th, 2020. COVID-19 may get more serious, it may not. It's always tough to predict, but we can all play our part by doing things like washing our hands, not touching our face, and making sure we seek medical attention the moment we feel that something's off or that we're experiencing flu-like symptoms. So please feel free to leave a comment, question, or suggestion in the comment section down below. And thank you for watching, and hopefully I'll see you guys soon in another video. Peace.